Good evening, I'm Jill Valley.
I'm Dennis Bragg.
More than 6,000 cases of the coronavirus have been reported since Wuhan, China first announced the diagnosis in some of its citizens.
And with cases now expanding beyond the borders of China, the question is, could we be next?
KPAX's Megan Mannering sat down with infectious disease specialist Pam Whitney today. So Megan, should we be worried about the coronavirus coming to Montana?
Well, not necessarily, Jill and Dennis. Whitney says the health department is staying on top of this epidemic, and they have a plan of action if the coronavirus happens to reach Montana. At this time, over 6,000 cases have been diagnosed and 132 people have died. But looking at the U.S., only 5 people have been diagnosed, and each of those individuals were in Wuhan, China at the time of the initial outbreak, and they have not died. Yesterday, Missoula health officials met with infectious control coordinators and members of the fire department to discuss how they'll move forward if the coronavirus escalates. Whitney says the group is monitoring the epidemic and staying in touch with the state health department. If a Montanan happens to return from Wuhan, China, Whitney says they plan to contact that person, monitor their temperature, and ask them to self-isolate. But at the end of the day, Whitney says you're actually much more likely to develop the flu than the coronavirus.
When you compare the numbers of people who are exposed, who may have symptoms, and the number of people who have actually ended up in the hospital or who have died, flu affects more people than this is affecting.
Now, while the disease hasn't impacted Montana, Whitney assured us that the health department is keeping a close eye on the situation. Back to you.